Well, the CDC saying today at a media briefing that the flu and respiratory viruses are hitting much harder and earlier than in the past. Anjalee Khemlani joins us now with more on this. And I guess, Anj, we've already heard the warnings that hospitals are beginning to overfill. But what else could we potentially see now over the next couple of months?
Well, we're definitely potentially going to be seeing COVID still. That's still on the horizon and plays into that threat of the triple-demic, tridemic, triple threat, whatever you want to call it. We know that Dr. Anthony Fauci, for example, was talking about this in a radio interview recently and stressing the fact that the country is not really at a good place when it comes to fighting the virus. We're still at more than 400 deaths per day. We're still in the thousands and tens of thousands of cases per day. And that is still leading the world. So not a good place at all. And with winter variants or a new variant on the horizon, that is potentially going to fare worse. We know that we've been following the BQ1, BQ11 variants, and they now combined make up 35%. That's an increase from the last time we discussed this. It was 27% before. The CDC now saying it accounts for 35% of cases. But now looking at RSV and flu, that is already stressing really the East Coast right now, the Mid-Atlantic, New England, Washington area, currently experiencing significant capacity strains according to the CDC. And they're expecting that this will move through in waves, hitting other parts of the U.S., similar to the way that COVID did in the past years. Now, what's important about noting the RSV and flu early season, it's really an early and strong season for both. In flu specifically, the highest level of hospitalizations that they've seen at this point in time in the year in over a decade. So that's where some of the concern is coming from. Unclear whether or not it will be a quick rise and plateau or if it will be a sustained surge of cases around the country. That's something that the CDC officials were unable to really pin down. But that's sort of where things stand. And we heard from specifically CDC's Dr. Jose Romero saying that previous years' atypical seasons due to mitigation against COVID left a large swath of the U.S. population uninfected, so children need to be infected essentially to get past it now. And the masking that was taking place before helped to keep all of this at bay in the past few years.
And Anjalee, I understand that Pfizer has released some new data on Omicron boosters. What can you tell us about that?
That's right. As anticipated, we know that their updated booster, bivalent booster, has been effective and is supposed to be more effective, in fact, than the initial strain, which is why administration officials have stopped offering the original vaccine and are pushing the updated bivalent booster. A new data out today saying that it was 4 times more effective for older individuals, which is really the target of this new shot. So after a month, they're seeing really good protection levels as anticipated.
Certainly some encouraging news area. Anjalee Khemlani, thanks so much.